It's an acronym for Anambra State Health Insurance Agency, which is the agency set up by law in 2017, Anambra State Health Insurance Scheme Law 2016, which was passed in December 2016, setting up a scheme for Anambra State with the focus and mandate to ensure that every resident of Anambra State is brought under a prepayment modality of social health insurance scheme that will give financial risk protection to our people, whether you are an indigent or not, once you are resident in Anambra.
My name is Miss Thompson Oluchukwu-Deme. We are from Akwa Ibom. I cook food and sell. So, but since I'm pregnant of this one, I stopped due to stress. So I stopped everything for now. I'm at home, I'm not doing anything. My husband is a graduate, but he's in our country. Graduate is a keke driver now. He's an Okada rider. So even when the governor say free delivery, free, but we went to the hospital and see that it's not free. We pay. So my husband said, let's try this Ashia off. So it's when I'm pregnant of this one, we register. It was awesome. Then, in fact, I wait till 8 months because going to Atlanta, if they no call 10,000, they go call 8,000. So with that kind of money, I no get time, there anywhere, chacha. So I go wait till 8 months. I will start at Atlanta. Next month, I go deliver. I go my way. But once it's Ashia, when they introduce me to Ashia, 3 months I don't start at Atlanta. Through Ashia, I learned that they teach a lot in Atlanta because I never experienced it and I didn't know. So it's 3 months I enter, I register for Atlanta. I know that all these series of things that I did not know, that they are teaching it. But due to that, because of money, I don't used to go to Atlanta.
So how much do you pay? How much do you pay for Ashia?
Sometimes 300, sometimes 500, depend on the drugs they give me.
My name is Surveyor Fobiabichukwu, the land surveyor. It has been wonderful. I do encourage my friends to enroll in Ashia because there are so many benefits. Because if you go to the hospital now, these days, you see that the payment is, what they will bill you will be outrageous. You'll not even be able to pay it. So when I look at, in fact, I had it from my friend that did it. So he told me everything that they will charge you 10% of the charges that the hospital will give you. That's what you will pay. So I said, let me give it a try. I did it about 5 months, let's say 5 months or 4 months ago. And since then, I've been benefiting it. Basically, the charges, like today, that I came, what the hospital charged me was 5,000 naira. But I paid only 500 naira. And I'm going home with my drugs and everything. I've not tried it with other hospitals. Today is the first hospital I'm trying it with. And they've been assisting us very well. There have not been any difficulty, challenges or that.
My name is Dr. Jigide Okudili. I'm the medical director of Divine Hospital Maternity, Okay. We have been with Ashia for a good number of years, and I can't remember exactly. And since then, the relationship has been cordial anyway. We've got many enrollees, above 2,000 enrollees here. And we're doing our best to maintain them and to treat them according to the principles and rules and regulations of Ashia. We've not had any problem with them. We've been a cordial relationship so far. And I'm sure the patients too have been averagely satisfied with our services towards them. I would say I must give credit to Ashia. They've been very prompt in their payments. They pay before the end of the month. They have paid the capitation for next month. And also the fee for service comes on time as well. So I think they are very much regular in their payment. We will give them credit for that.
My name is Umema Benson Vera. I'm a civil servant of Anambra State. I came for the registration of Anambra State Health Insurance Agency. Why do I come for the registration? Because of the benefits attached to this. Definitely my health is my priority. I've come for checkup, I'll go for drugs, and at a reduced price from Anambra State. At least these benefits will help me as a human being to go far in life, which make us fit for the day, and as a worker.
I'm a Wakedo, a student of Federal Polyoko. I'm here for registration of Ashia. I'm registering because there are so many benefits. I have a sister who is benefiting, like she's giving birth 2 years, and she benefits so many. She paid 10% of it. Like at Nenta, the free is low.
So far, so good. We think that to the extent of the mandate that we've been given, we have reduced out-of-pocket health expenditure for people who are enrolled in our scheme from where it used to be 92.1% to 10% out-of-pocket health expenditure, because all they need to pay when you are enrolled in our scheme is 10% the cost of medication, not for these other services that you access. That singular plan, Anambra State Universal Health Coverage Plan, is accessible to every one of them, the same terms and conditions and what have you, so that we can truly say that the principle of progressive universalism and equity in considering social health insurance scheme is actually what we are doing here. The component of subsidy, which makes it truly social by way of what the state government is putting into the financial pool to help us in our risk pooling mechanism, has never lacked, and that has kept us where we are today in terms of our quality of care that we render to people and the sustainability plans of this agency.